pericardium 7 point, that point to be called as a daling. To understand, the point is located where exactly? So on the crease of the wrist itself. So there are so many creases, 1, 2, 3 crease. You understand the point is located on the first crease on the palm. So when you look at the palm, from the palm you can find the first crease. So that crease to be called as a pericardium 7, right? Right, that point is called as, if you remember about your darling, then you understand that this name also kind of the thaling, the pronunciation is thaling, but this point to be considered as a, to remembrance, that is the D-A-L-I-N-J, darling, right? So this point is the source point, the which we have seen the pericardium 6 is the luo connecting point, and pericardium 7 to be considered as a source point. So source point, it receives energy from the coupled organ, so that means interior and exteriorly communicating point by the pericardium and then triple warmer. So therefore this point to be treatable for the various conditions, but in fact this point to be called as a, is the command point. Pericardium 6 is the non-command point, but it works as a command point, but pericardium 7 is one among the 5 shoe points is this point, but in fact this point is the earth point of the pericardium. So this point is regulating to the pancreas. If you activate the pericardium 7 on the right side, so that's activating to the pancreas. If the pericardium 7 is activating on the left side, that point to be activating to the spleen. So therefore bilaterally you want it to activate, you can activate, or unilateral also can be recommended. So at the same time the pericardium 7 is equivalent to spleen 2, that means it's communicating to the earth. Pericardium 5 is equal to LU10, that means it is communicating to the pulmonary system, right? In the similar way, pericardium 7 is a good point to treat for the wrist related diseases, or the wrist arthritis, or there is the carpal tunnel syndrome. I told you, when there is the carpal tunnel, that means is the medial now get the compression, so that leads to the numbness and severe and pathetic situation of the pain the patient feel on the either right or left hand, and could not able to do any much activities, and she could not put the hand in the water, and so much situation. That condition, certainly you can use the points which we call as a pericardium meridian points, is good point to treat for the carpal tunnel syndrome. Even most of the conditions, in fact we have treated to the patients who are suffering for this condition without surgery. So therefore there are the activation point. You understand there is another point which we called as a the Chinkyu and Lichu, that is LU7 and LU8. These two and LU9, these 3 points are good point to treat for the hand arteries, anything related to the brachial artery, then radial artery, ulnar artery, biceps artery, all are regulated by activating certain points. Those points to be called as a Lichu, and then Chinchu, and then Taiyuan. These are the lungs point. At the same time is the medial now. Also you can add up that point to be called as a Nichuan. At the same time is the Darling. So together integratedly add up to activate the nervous system, circulatory system, and also to the venous system. Right. So when you want to add up another point, that point to be called as a Shenmen, which includes the ulnar nerve also. Right. So therefore this point is good point to treat for the diabetes mellitus. This point is good point to treat for the muscular related diseases, especially related to the muscular pain, gastrocnemius, muscles pain, etc. At the same time when the person is getting the ganglion, even that condition is the one point you can activate on the ventral side of the body, that point to be called as a Yang Qi, that is the triple warmer 4. At the same time you just add up the another point is the ventral side, you just add up pericardium 7 together. Right. When there is a severe pain, of course you can add up another point is the Sanjian point, that is Sanjio, that is Li3. At the same time, of course, is the Hego, another point you just add up for the pain. Right. So therefore you understand when this get the problem. So when this meridian, after that this tendons, so this tendons will become the one tendon, all these muscles will become finally terminates on the tendon on the palmar region. So anything related to the nerve, which we call as a medial nerve, is not supporting to this middle finger. When there is a problem, these 2 fingers to be considered as a radial, these 2 fingers to be called as a radial nerve, and this is as a medial nerve, and this is called as a ulnar nerve. So therefore anything related to the medial nerve problem is there, then you understand Darling is good. When there is an index finger also connected, then the radial nerve also connected. When there is a ring finger is connected, then connected to the ulnar nerve also. So in this condition, when you wanted to treat only to the medial nerve, then P7 point, descend on the downwards direction and communicating to the pericardium 8 is always good. At the same time, remember, so pericardium 7 also good point to treat for all the coronary artery related diseases, especially there is a cardiac blockage is there, even that condition also can be regulated. No doubt the H7, H6 and H8 points are good point to treat for the cardiac system. At the same time, cardiac conductivity, at the same time coronary arteries can be regulated by activating point called as the pericardium 7. So therefore, when the pericardium 7 is activated, at the same time when there is the problem on the palmar region, there is a problem in the lumbrical muscles, when the patient could not able to open the hand, even that condition, so certainly we insert the needle here. So when insert the needle here in the downwards direction, 3 needles in the downwards direction, which leads to the problem to open up the lumbrical muscles, to open up the digital nerves, to open up the digital arteries. At the same time, which we called as there is a problem which we call as a trigger finger. So either the trigger thumb or maybe the index trigger finger, middle trigger finger, or the ring trigger finger, or the index, small pinky trigger finger. Even that condition also you can find the points are located here. Even there is the kind of the ganglion, there is a kind of the globule or nodules formed under the muscles inside. So that causing the problem, could not able to open. Trigger finger means once they do like this and they have to open with the support of the finger. So that's called as a trigger finger. When there is a thumb is there, when they do like this and could not able to open normally, so they have to open on their own, that causes the pain in this region. Even that condition also can be treatable by opening up this medial nerve, radial nerve and ulnar nerve. At the same time there is the limp is there or lump is there. Even that condition, it's essential to do the fire needling to dissolve that. So once happen that, certainly then easy movement can be taken place. At the same time certain massages, at the same time certain exercises is always is good. Ask them to do like these exercises. So once they do the knuckles, so open up all these things. At the same time give the pressure to these points. So once keep giving the pressure to these lumbrical muscles, 1, 2, 3, 4 muscles. So this will be open up to that. So most of the times once we do this kind of the activities, at the same time you can find the rubber ball or there is the wood ball which we call as the acupressure ball. So once activate continuously and vigorously, maybe in a day 2 to 3 times, 2 to 3 minutes, each time. So that also in fact is good to activate this, open up and also regulate the pulley system, right? So when we look at the another point which we call as a pericardium 8, that point, this pericardium 8, the point called as is the command point. At the same time it is a horary point. At the same time this point to be distal point for the heart. So I told you the pericardium 6 is the distal point for the chest, which includes all the lungs also, spleen also, stomach also, esophagus and heart. But at the same time specifically you wanted to treat the heart system, then the distal point for the heart to be called as a lakung. That point is called as a pericardium 8. So therefore you remember when you wanted to treat for any the heart related conditions or hypertension or the coronary arteries blockages, even the myocardial infarction, that condition also can be treatable by activating this point. But in fact where this point is located, you just flex your middle finger or you just flex all the fingers where the middle finger touches to the palm. So that point to be called as a pericardium 8. You just press like this and then try to find out where your middle finger is touching. You understand there is the main palmar crease here, there is another palmar crease is called as the second palmar crease, but the point is located on the second palmar crease, not on the first, but not above the level also. But however once you touches, that whole area is related to the heart system. But as per the reflexology, that point to be called as a kidney point. But kidney and heart both you are activating at the same time. When you activate this point is always is good, you are activating integratedly for the cardiac system, brain system. At the same time this point is treating, as I told you, is the brain, but this point is treatable for the pituitary gland. But this point to be treatable for the anterior pituitary, at the same time is the posterior pituitary as well, because of this point works for the pituitary. This point is the horary point of the heart meridian. This point is working to directly not only to the heart, at the same time you are activating to the brain system as well. At the same time when you are using this point as a local point, then you understand this point is treatable for the hyperhidrosis, the unnecessary sweating comes with the palms. Even that condition, there are the 2 points you can activate. That point to be called as a shafu and then lakung. That point is H8 and then pericardium 8. Both the points is good for the hyperhidrosis. At the same time you understand when the person is suffering for the trigger fingers, this point you can add up, because of this point is closer to that ganglion, closer to the cyst. So even this point, once you apply, you descend downwards direction, which communicating to the lumbrical muscles. At the same time, once the lumbrical muscles get open, this works for the digital muscles, this works for the digital arteries and the digital nerves. You understand? So therefore, always is good. This point is treatable for the so many conditions, but however, this point is a slightly painful point. When we look at the micro meridians level, but this point also works for the stomach, because of the Ren meridian starts from here, it ascends upward direction, and this is the navel. From the above the navel, this point is located. Then you understand how the Chungwan point, we are treating the Ren 12 point for the influential point for the Fu organs. That means it is activating to the all the stomach related diseases, where the yang pulses we could not able to find out at all. Due to that time, we apply the 2 points, that point to be called as a 0 point on the ear. At the same time, we apply the another point is Chungwan, that is Ren 12, 4 Chun proximal to the umbilical region. So in the similar way, when you are activating this point in the micro level, you are activating to the Chungwan point also, Ren 12. So therefore, having the multiple functions by activating this point, so this point to be act as a synergy point for the various indications, right? So now let me see the last point is, so last point which we call as a pericardium 9, that is Chung Chung point. So that point is located on the midpoint of the middle finger. So extreme level where the nail base, that means where the nails ends, that last particular point to be called as a pericardium 9. This point to be called as a homeostatic point. This point to be called as a activation point for the brain. At the same time, tonification point, reinforcing point, stabilizing point for the brain. You understand this point in fact is very crucial. This also having the synergy effect. Now look at the micro meridians. Even the who knows about the Sujok, even this meridian, the first meridian is the spleen meridian, and then the middle meridian called as the liver meridian. But however, the Sujok chart they have given different way. The first meridian is the liver meridian, the second meridian is spleen meridian. But however, this middle finger to be considered as a Dadun point. Dadun point means is the liver 1 point. You are activating to the 1 point together. In the both ways you are activating. This 1 point you are activating for the pericardium 9. This point to be pericardium 9. At the same time, you are activating to the liver 1 point, right? So as per the Chinese philosophy, this is the point is terminated on this particular finger. But of course, the pericardium 9 is not terminated on the pericardium 9, but the pericardium 9, that means pericardium meridian is energy terminates on the Quan Chung point. That point to be called as a small Sanjio 1, not the pericardium 9. Because of the pericardium 8, the ramification goes in the downwards direction and then communicates to the small Sanjio 1 point. So that pericardium meridian ends on the Sanjio 1 point. But however, as per the meridian pathway, this terminate, the last point to be terminated on the pericardium 9 is on the middle finger, where there are the 2 points are coinciding each other. That point is pericardium 9 and then liver 1 together. At the same time, there are some authors believes that that point is located on the radial side of the nail base of the middle finger. So the point is located here. You understand, the point is located on the thumb side, the radial side, not on the ulnar side. You understand this point is pericardium 9. Here also I can tell you, as per the micro meridians, then you understand the point is located is another point which we call as a Li Tui. Li Tui is nothing but a stomach 45. When you wanted to treat stomach 45 on the toe, you can use it. You could not able to know there is no toe at all. Amputate the second toe. In that condition, you just select this point, right? So in the similar way, when you have, there are the 1 point which activating to the 4 acupuncture points at the same time, but all the 4 points to be called as a command point, which having the ability to transfer the energy from one meridian to another meridian, one organ to another organ, the transformation of the energy taken place from one organ to it, shifting of the energy to be taken place. So therefore, when you have the dilemma, when you activate both the points, really amazing, you can find numerous diseases can be treatable. One single point treats the so many diseases. Then you understand there is only 1 point you are communicating in the both the ways. That means is the middle finger you are activating. At the same time, you are activating on the radial side also. Then you are activating to the 4 point. That point is Chung Chung. That point is pericardium 9. Dadun, that is liver 1. Then Li Dui, that is stomach 45. At the same time, pericardium 9 itself on the radial side as well. So therefore, you are activating to the brain system. You are activating to the liver system. You are descending the direction of the energy, activating to the the stomach system, that means digestive system also. When the stomach is ascending upward direction, called as a rebellions of the chi is going upward direction, that also can be regulated by activating this point, right? So there are so many conditions. Certainly you can select one point to treat for the, so hundreds of diseases can be treatable by activating this 2 point. At the same time, this point having the adrenergic effect. But you understand, this point is when I can tell you about the one gland also included. That gland is called as a thymus gland. Right, so this point to be treatable for the thymus gland. No doubt the thymus gland will going to dissolve after the puberty at the age of 14 years for the girls. At the age of 16 years with the boy, the thymus gland will be dissolved. So and for the defensive mechanism, what is required? No doubt the melatonin, which is released by the pineal gland. At the same time, the thymus gland always is good to treat for all the defensive mechanism in our body, the protective mechanism in our body, to regulate our thermodynamic effect in our body with the support of the hypothalamus. So therefore, this point also good point to treat for the thymus gland. You understand?